So I want to make it clear, these are my exercise MVPs, my most valuable exercises for the patient that may be difficult to get started. I know all physical therapists are excellent at upgrading the patient from their current level to get them to the next step on their recovery. But these I want to make a point of sharing with you for those problem patients. For example, the bedbound patient who wants to sleep, I usually don't disagree with them. I want to build their trust, and I'll say, if you're going to have sleep as much as you need to recover. But when you're awake, practice the breathing exercises that I taught in the first part of the program, where you inhale through the nose and pause, and the patient automatically feels better with that. Combine that, I instruct them on the best of their life game, which is where they visualize when they were at their best physically, mentally, emotionally, spiritually. And that combined with the breathing is a great start for that patient that doesn't want to do anything else. If they're willing to do more, I immediately suggest they do abdominal squeezes, which improves digestion. And the abdomen is considered the main lymph drainage if they have lymphedema or any type of swelling. And in athletes, we call it the willpower zone. So with that type of encouragement, I say, hey, can you just squeeze your abdominals, ideally with a big exhalation? It's kind of activating the transverse abdominis, Pilates style. And then inhale, yoga style, into a big diaphragmatic, big belly breath to relax the whole structure. So it's a squeeze and a relaxation at the abdominals. And if the patient's willing, I say do 5 or 10 and you've started on your recovery. And if they are willing to do the next step, then I talk to them about what I consider the most powerful low back exercise that they can do when they're laying in bed, and that's the pelvic tilt. It's easy to perform, and I'll show that in the video next. I want to give a point here to Peter Gasku, because in the bed program, I teach what I call back walking, which is referred to as cross crawling by Peter Gasku, who I think has written the best and most complete self-use book on how to be pain-free without equipment. And this book is titled Pain-Free. His name is there. It's just that I do upgrades to the cross crawling for athletes. And it's easier for me to call it back walking and back air walking, right up to back air running and the number one ab exercise for runners. So I will show you those in the next slide.